One second. Go live. Okay. Good morning, good afternoon, and good evening. Welcome to the 2023 Social Media COVID-19 Influencer Awards. I'm Vanessa Ruck, here as the co-host, and I'm also joined by Tim France, who is my co-host and producer of this award ceremony. Now, COVID-19 pretty much hit the world by storm, and there was a lot of information out there in the world, particularly online. There was a lot of misinformation, false news, and it became very difficult to know what was the facts and what was the information that we really needed to listen to. And these awards have been created to try and recognise and thank the influencers across social media for the work that they did to help cut through that noise and give people the right information at the right time. Now, we are live here, so we are in the UK. Hopefully we're not going to have any technical issues, but one of the beautiful things about being live is the fact that we can interact with you as we go. So please do get in the comments and let us know, first of all, where are you in the world? We're in the UK. This is a global awards, so let us know in the comments. Now, before we get into the awards, I'd really like to talk to you, Tim, about a little bit of the background of this awards and how we've got to the point of being where we are today.
Sure, happy to. Something that I've found myself, thanks very much for the introduction, by the way. Something I've found myself saying a lot over the last 6 months or so while we've been running the awards is that the awards provide a spotlight on people who helped people make sense of the pandemic through social media. And so I'd like to think a little bit about why and how those people, those influencers, are important. If we cast our mind back a little bit to the beginning of the pandemic, it was a completely new disease. We didn't know anything about it. Was human-to-human transmission possible? Could you be infected and not have symptoms? Would there ever be a vaccine or treatment? There were really basic questions we were asking and trying to clarify. And at the same time, in early 2020, about half of the world, half of the entire world, was using social media of some kind, and for an average of about 2.5 hours a day. So, while you've got this need, this real hunger for basic information, and millions, billions of people on social media, it was obvious, clearly, social media was going to be important. And right at the very beginning of the pandemic, the most important people were those kind of international experts who could help us just understand some of that basic early information about the virus. But then the emphasis shifted, and as more countries were affected by the pandemic, we started to think more in terms of what's happening in my country, and how is the virus spreading? What is my government doing? Are they doing a good job? And so our kind of attention on social media shifted more to some of our national authorities and thought leaders to tell us that local context. So the main point I'm trying to make is that throughout the pandemic, the people who were the real influencers, the really important people on social media, really shifted as the pandemic progressed. The second point that I'd really like to make is that we tried to structure the awards so that, and I think we can show you some of the categories of the awards on screen. I won't go through them, but what we were trying to do was structure the awards in a way that really reflected some of that shift in understanding and knowledge and what people were looking for in terms of information, from basic information about staying safe right through to things like vaccine trials and the importance of young leaders in communicating with their peer networks and so on. So that's the second point, is that we tried to structure everything in a way that really reflected that global reality. And the last point is that we couldn't have done any of this without some really amazing partners. I will thank everybody later on, but I just wanted to kind of recognize that we worked with 8 amazing co-host organizations. We had 10 people who were part of the judging panel to help us choose who would ultimately be the winners of the awards of each category. And they, each of those groups really each of those partners really lent their authority and credibility to the awards as a whole. So that gives you a little bit of information about what we're trying to do. I would also like to have invite a few words of welcome from Professor Jeffrey Lazarus. Jeff is a a professor of global health at IS Global in Barcelona, and also the City University of New York School of Public Health. Jeff and I kind of co-founded the Social Media Awards over a decade ago, looking at global health. We did it together, and we really kind of spurred one another on to do this again now for COVID. And so Jeff, as ever, he won't mind me saying, is on an airplane today. And so we've recorded his words of welcome, and I'd just like to play those now. Thank you.
The role of social media during the COVID-19 pandemic really can't be overemphasized. It was a central and defining element in how the general population understood all aspects of the pandemic. People were using a range of social media platforms. It was used by governments, health authorities, lay people, clinicians, school teachers, everyone. People had questions, people were answering questions. These social media awards started over a decade ago when Tim France and I were involved with Health Systems Global and launched social media awards on health systems. And then Tim went on to run social media awards on Malaria Heroes. So it has a long history. It hasn't been used a lot, but we decided to bring it back for COVID-19 in order to recognize and really honor the individuals who have made a difference and have used a significant amount of their time to share important information about the pandemic. One of the main objectives of the awards was to honor individuals who shared important information, evidence-based information, links to further information. The other important objective was to contribute to the pandemic recovery phase, to really say, social media has been so controversial, so complicated, but also so used during the pandemic. We've learned a lot about social media from its use during the COVID-19 pandemic. Another question is how well it will be implemented if there are future pandemics. But we learned the importance of fact-checking information and understanding who are influencers because they provide important and reliable information, and who are influencers because they share false and disinformation. We also learned during the pandemic the importance of engaging with social media platforms, of regulating them if needed, but encouraging them to self-regulate to make sure that all forms of false information, malinformation, disinformation, misinformation are checked and stopped by the social media platform. The nominees and the winners of the social media awards are truly remarkable people. They shared a lot of information, a lot of their time. They put in a remarkable effort to help bring this pandemic to an end, to support others, to combat false and misinformation.
Fantastic. Jeff, thank you so much for that background and information. It's really fascinating to see sort of how much energy and time has gone into creating these awards. And so I want to thank everybody that put in a nomination and has been part of it. Now, this process has taken 6 months. There have actually been over 300 nominations from 50 different countries. So when we say that this is a global awards, it really is global. Now, those 300 nominations have been shortlisted down to 30 through the team of the judging panel. There can only be 7 winners because there are 7 categories. So later on, as we go through this live award ceremonies, you will be finding out, one, if you've been shortlisted, who has been shortlisted, and also who the winners are going to be. There have been over 11,500 votes, so it's been a very intense and very exciting period of time. Now, the way that we're going to structure this award ceremony is we're going to go through each of the 7 categories individually. We're going to do a little bit of an explanation about what the category is and the sort of thought process behind it. I'm then going to hand over to our co-host, organisation, who's going to give a little bit more information about their organisation and the link to the Social Media Awards, before watching a video of all of the nominees. So that's the time to find out who has been shortlisted down before the big drum roll of the winner of each of those categories. So it's going to be a very exciting hour. Now, if you are watching, please do get in the comments and engage. We can actually see your live comments coming in, and we'll try and sort of pop up and read out some of your comments as you go, particularly if you want to congratulate any of those nominees and winners as well. We do have a hashtag as well, so that is SocMed for Good. There it is up on the screen, so you can use that, and we will be keeping track of everything that you have coming through. So I would suggest we dive straight into the first category. So the first category is pandemic policy and practice. Now, around the world, there has been a lot of regulation, government initiatives, and information policy level going out there, which has been changing, developing, and this category is all about helping people know what is going on in their nation. What is the situation in the workplace? What should be happening with schools and the regulations that come through? So some really important information that these influencers have been sharing. So we're going to head over to our co-host. So we have Elaine Fletcher, who Geneva. She is with the Health Policy Watch. Elaine, are you with us?
Yes, I am. Hi.
Fantastic. It's great to have you. Thank you so much for joining us. Do you think you could give us a little bit of a background of your organisation, what you do, and then a link to the use of social media through the pandemic?
Yeah, sure. Well, we're a daily media service dedicated to global health news. We're based in Geneva, but we practice what we call a network approach to the news. So we want to try and link the policy debates that go on here, particularly at WHO and elsewhere. I'm being told I need to be a little closer to the mic. Is that better?
It's okay. No, I'm
Okay.
just asking somebody here, Elaine. Sorry. I wasn't.
Okay.
I wasn't
Okay.
gesturing you.
Better.
I was just trying to get our headphones a bit louder. Sorry.
We try and link the global health debates that are going on in big agencies like WHO, Global Fund, Gavi, with what are the realities and trends on the ground. We know we have big, important developing hubs in the BRICS, India, Brazil, South Africa. We have a network of reporters that are spread around the world, and they contribute regularly to our news reporting. My deputy editor is based in Cape Town. So we really try and do this sort of joined up, holistic approach with news features and analyses.
Fantastic. And how was sort of social media through the pandemic?
Well, I think as you've already said, this was the first Twitter pandemic, right? Health, I always noted, even I was at WHO in the 10 years before I came to Health Policy Watch, and I always noticed how health policymakers and practitioners were early adopters of social media. I would often see in very detailed expert meetings, people tweeting out what was going on in the meeting. So when the pandemic hit, these trends just only were accentuated. So this was the announcement of the pandemic happened in real time to a global audience and was immediately tweeted around the world. All the big moments were conveyed instantly on social media. And I think also the big science to policy debates were played out on social media. And that was something that was really interesting for us. You know, issues, sometimes very complex technical issues, because what we're talking about here is the science to policy bridge. You know, what we're trying to do is get good evidence into the policy so it's more effective, right? That's the goal. And we want to combat misinformation at the same time. There was a huge range of fake news and simplistic messages and politicians putting out their messages. But we also had so many serious scientists and practitioners conveying with often complex charts, graphics, really difficult ideas, but things that were really important for us to know about what kind of mask we should use, or whether lockdowns were efficient and effective, and in what categories and contexts, or what about travel policies, what about testing policies. All this goes back to the basic science. So we really relied heavily on social media also to get that kind of primary raw information and then distill it into something as a media organization that we could interpret and convey out as sort of referenced material.
I just want to say thank you as well, Elaine, because Health Policy Watch wrote some great articles about the nominees and the awards over the past 6 months. So that was a good example. It's a great connection. Thank you.
Fantastic.
Yeah, it was
Shall
an
we
interesting...
move on to see who the nominees were?
Absolutely. Who's been shortlisted for the Pandemic Policy and Practice category?
Wow, what an incredible list of people. It's amazing to think that the power that it can have through social media and helping us get through all of that information. Elaine, can we hand over to you to announce the winner?
I'm told this is the Oscars envelope moment.
Yes, so it
is. Take a deep breath. The winner is Cynthia Reyes, professor and science communicator at the University of Guadalajara in Jalisco, Mexico.
Fantastic. Congratulations, Cynthia. Remember, everyone out there watching this, get in the comments and let us know your thoughts, pass on your congratulations.
I'm sure many of you will have followed Cynthia throughout the pandemic and the work she was doing. This was Pandemic Policy and Practice was so diverse. It was really quite a very difficult category to choose one person. I'd encourage you all to look at all of the shortlisted nominees, but congratulations to Cynthia, that's great.
Fantastic, and of course her social media handles were just up on the screen, so do make sure you give her a follow. Brilliant. Elaine, thank you so much for joining us.
Thank you.
Moving on then, we have the second category, which is staying safe. So this is all about working out how to keep yourself protected and safe. We had lots of different contact tracing apps. We had all of the different ways to work out what do we need to do to keep ourselves safe. Should we be using masks? Should we be washing our hands? Should we be avoiding people? The social distancing? Lots of different messages and sort of advice going on across a period of time. So this category is for people particularly recognising the support in the area of staying safe. So we're going to go to our next co-host. So we have Catherine Clearly, who I believe is in Cape Town, South Africa. So Catherine, are you on the line? You are from the Internews Health Journalism Network.
Yes, thank you so much, Vanessa. It's great to be here.
Fantastic. I love technology. Amazing. Could you tell us a little bit more about your organisation, what you do?
Of course, so as I said, it's an honor to be here. We're so delighted to be a co-host for these events. The Internews Health Journalism Network is a dynamic global community of media practitioners, communications professionals, civil society members, technical experts, as well as citizen journalists who all share a passion for accurate health information, as I'm sure all of us here do as well. That's why we're having these awards, because we know that information saves lives. As of this year, our network consists of about 1,600 journalists and media professionals from over 87 countries. So we're very proud of our very diverse HJN family, as we say. Our members are committed to improving mainstream health journalism and improving the quality and depth of health news worldwide. And we work with and support our members by fostering relationships, offering reporting resources, story grants and fellowships, as well as hosting events that provide a space for in-depth discussion over the latest health issues that journalists face in their everyday work.
Fantastic. Accurate health information is really a word that just kind of somehow gets some emotion going inside, because there's always so much confusion and information. So that's an amazing element.
I love the information saves lives line as well.
Yeah, it really does. So how has your organisation been impacted through the use of social media and the COVID-19 outbreak?
So during the COVID-19 pandemic, social media kind of became this space where it was like kind of an only space where people could continue to interact and engage with each other on all sorts of topics. With countries in lockdown and a slowing global economy, people also coincidentally had more time to use social media. People were baking banana bread and using social media. At the same time, journalists were also highly impacted by this, meaning that they needed to find new ways of working through social media to make sure their stories and their messages were getting out. So we saw journalists using social media to quickly push out daily information concerning the latest COVID-19 data. This was case numbers, deaths, and later on we saw vaccination updates in terms of how countries were moving forward with their rollout of vaccines. So in this way, social media really provided a space where journalists could effectively and efficiently communicate with their audiences. But however, as you said in the earlier part of this presentation, at the same time as the pandemic, we also saw the rise of this really nasty infodemic. And with that comes mis and disinformation. So as the HGN, we're continuing to work with journalists in communities where the fight against mis and disinformation is ongoing. This infodemic has also really eroded trust in communities. And this trust is not only in the media, but also in health systems and healthcare providers. We work very closely with another Internews project called Rooted in Trust that actively engages with journalists in communities where harmful rumors about health are ever present. And Rooted in Trust uses specifically social media listening and rumor tracking tools to support journalists to help rebuild trust in their communities, the media, and health systems.
It's incredible to see the sort of transition between more traditional journalism and what you think of sort of a user-generated social media content and how they can be utilised to help give the voice to the truth and the fact side of that delivery.
Yeah.
Should we have a look at the shortlisted?
That's an amazing set of shortlisted nominees. When you look at it, I can see and remember the real diversity of the things they were working on, from clean air to, you know, some of the prevention approaches. And staying safe was such a controversial area in many ways. You know, people saying about conformity and polarization among people. So it's a really important category.
Catherine, can we hand over to you for the envelope winning announcement?
Absolutely. So I have a little makeshift envelope here. With
amazing!
I think everyone deserves that. So I'm going to build anticipation. We're going to unfold my little makeshift envelope.
I feel like we need a drum roll.
And the winner is, little drum roll, Trisha Greenhalgh from the United Kingdom.
Wow.
Fantastic. Congratulations, Trisha.
I mean, Trisha's been so well known during the pandemic, especially here in the UK, and probably could have been shortlisted for some of the other categories as well. She's worked a lot long COVID as well. So congratulations, Tricia. Thoroughly deserved. And to the other shortlisted nominees in the Staying Safe category. That's incredible.
We mustn't underestimate how big an achievement it is just to be nominated and to be recognised for this. So if you're not a winner, you're still a winner for the fact that you've been recognised and nominated, and we're super proud to have had you sort of in the awards.
Absolutely.
So Catherine, thank you so much for joining us. I really appreciate you tuning in. We're going to move on to category number 3, which is understanding the virus. And this is definitely a complicated thing. Like, what is it? How does it spread? Where does it come from? How does it interact with underlying issues? There's so many different things going on in this category. And it's an important one, as all of them are. So we're going to go across to our co-hosts again. So we've got Adelaide Surican, the Barcelona Institute of Global Health. And I've probably given you a clue that you are in Spain. Hopefully it's nice and sunny.
Yes, it is. Hello, nice to be here with all of you.
Fantastic. Thank you for joining us and for the support of the awards. Do you think you could give us a little bit of an introduction to your organisation and what you do?
Yes, of course. Our organization, in short, it's called AES Global. It covers all aspects of global health. So going from infectious diseases such as malaria or Chagas to urban health and the environment. And it goes from very small scale parasites, genes to large scale solutions in the field, for example. Its overall goal is basically to close the gap in the big health inequalities that exist in the world, between countries and even within countries. But AES Global is not just about research. It dedicates a lot of efforts to translate and apply the knowledge it generates for the benefit of society. And actually that means reaching out to very different publics and audiences, from policymakers to the young public. And for this, we use different formats and different channels, obviously including social media.
Fantastic. So did you find any challenges with the use of social media with that during COVID?
Yes, well, as Tim was saying, when COVID arrived in Europe, very little was known about it, except that it was caused by a respiratory virus that was similar to MERS and SARS, that it was extremely contagious and that many people were dying. So these circumstances created an unexpected demand for information, and this was, as Catherine said, met by a huge infodemic, where it was very difficult for the people to separate what was scientifically rigorous information from what was hypothesis, rumor, or outright misinformation. So at AES Global, we immediately began curating content based on the scientific evidence that began to come out, and our social networks were one of the vehicles which we used to disseminate and share this content. So our job was to provide rigorous information that was obviously not free of uncertainty at that time or even now, but that the community could trust and use to make their own decisions.
That trust is so important, especially with that word infodemic. There was just so much information going on. Mm-hmm. Shall we watch the nominees?
Please, yes. The shortlist for this category. I think as a molecular biologist myself, understanding the virus was probably the category that suited me best, and it's just incredible the range of people who were nominated and the kind of content and work that they shared during the pandemic. It was great. I mean, I'm sure many of you follow the people who were on that shortlist.
Indeed, indeed. And they did a magnificent job of staying rigorous, clear, objective, while also explaining explicitly the uncertainty and why there were things we did not know. No? So they did a marvelous job, and I think this award is one of the way of recognizing them. Mm-hmm. So without saying more, I prepared the little envelope also. And the winner is Vinod Balasubramaniam, Senior Lecturer at Monash University in Malaysia. Congratulations.
Congratulations, Vinod. Really excellent work during the pandemic. Thank you. And everybody.
I'm really enjoying the diversity of the global locations that we've got of all these award winners as well. It really shows how COVID-19 hit the world, not just any particular region. So it's fantastic that we've got nominations coming from 50 plus countries. So Adelaide.
And thank you, Adelaide, I was about to say that, and for IS Global's support. It has been really sterling all the way through the awards. Thank you.
It has been a pleasure.
Thank you so much for joining. Time to move on to category number 4. And this is a particularly special one to me. So this is the Young Leader category. And this is specifically recognising those influencers out there who were under 30 years old. And given COVID, didn't mind what age we were, it was really important that the information was getting out to all different age groups. And so for the influencers under 30, you have your very own category to recognise the support that you gave us through the pandemic with the dissemination of the factual and the right information through all of that noise. So we have Gary Asselyan from the TDR organisation joining us. I believe you're in Geneva. Gary, thank you so much for joining us.
Yes, hi.
Fantastic, we can hear you. Brilliant technology, great. We are winning so far. Great. So Gary, do you think you could give us a little bit more information about TDR and what you do?
Yes, of course. TDR is a special research program. It's based here at WHO, and we fund and support research for infectious diseases in collaboration with countries and research institutions. And most importantly, we support research capacity building in countries and institutions to conduct that research all over the world.
So it's often training of young people and...
yes, definitely. We do engage a lot of graduate students and young researchers. We have specific grants that are targeted with up-and-coming researchers in countries, and that has a profound effect on their future careers when they engage with us.
And during the pandemic, Gary, could you say anything about use of social media at TDR? And I know you're heavily involved in a podcast for TDR. Would you? How did that work?
Yes, so obviously social media was used in a way that we communicate some of our work, but you already mentioned the podcast, which was launched by TDR during the pandemic, and it's quite broad. Global Health Matters, it's the name. And one of the early episodes of the podcast was focused on communication of science. And that was quite interesting. And the guests on the show shared their experiences. And most importantly, one of them from Brazil a scientist shared her experience in dealing with misinformation around vaccination or autism, and how, as a scientist, she had to learn how to communicate science with her colleagues or with broader audiences. And that was one of our successful episodes.
Yeah. For those of you who don't know the Global Health Matters podcast, I'd really recommend that you listen.
Fantastic.
And this is slightly different, this shortlist, because we don't have a shortlist for the Young Leader category. We actually like to showcase all of the nominees, and we can't do that in a short video. So we're going to put all of the nominees for the Young Leader category onto the website. So I think first what we'll do is ask Gary to announce who the winner of the category is, and then we've got a short video clip showcasing the winner.
Okay, great. So I'm here in Geneva at WHO, and I'm opening an envelope.
We've got another
with the
envelope.
name.
I love this.
Yeah. And the winner is Shivan Kaneja from Canada.
Amazing, amazing. For those of you who don't know, Shivan is, I think, still a grade 10 year student in the school in Canada, and has been developing air purifier machines from scratch, and actually offered to make air purifiers for anybody who needed one in his community. Some amazing videos on his site, a really amazing young man, so it's great that he won.
It's great to recognise the young souls that are going to be leading the future for us, so fantastic.
I think Shivan's already made it quite clear he's really looking forward to being an engineer. That's what he wants to do.
Fantastic, congratulations. So we move on to the little video then?
Yes, yeah. Anything, would you like to say anything else, Gary, before we show the video?
No, congratulations on this great effort, and science communication and influencing public's knowledge of science is something we should all strive for. So great initiative to all co-hosts and you particularly. Thank you.
Thank you, Gary. Thank you.
Thanks, Gary.
Let's have a look. Again, I didn't mean literally again. Again, Shivan, congratulations. And Gary, thank you very much for taking part and for TDR's support to the awards. This is like the moment in the middle of a concert where the...
We get popcorn?
Maybe in a minute. We'll look into that. But we just want to pause for a moment just to share some thank yous, because we want to do this before we get to the end. So, as I said at the beginning, we really couldn't have done this without so many different partners. And I want to go through a long list of people that I thank, and I'm going to try and do it as quickly as I can. First of all, the 8 co-host organisations, I'd really like to thank them again, and the 10 members of the judging panel. We also had 2 sponsors who provided some resources for the awards, and that was Inish Communication, and you'll see a team of people in a minute, and they really kind of, as well as providing, financial resources, also provided some amazing in-kind support. So thank you to the team that you're seeing on the screen now. The second sponsor was Novavax, the vaccine manufacturer, so thank you very much to Novavax for helping to provide resources for the awards. I want to thank Vanessa for co-moderating today, and everybody that you can't see behind the scenes here in the studio. The awards were organised across several major time zones, probably all major time zones actually, and many candles were burnt at both ends and in the middle, so thank you for everybody who was centrally involved. But I particularly want to thank all those who nominated and voted in the awards. You are actually who made this possible. And of course, the last and biggest thanks of all go to all the nominees themselves for your efforts and dedication to share vital information during the pandemic. Just a big thank you to all of the people I just mentioned. Thank you very much indeed.
Can I throw in a thank you to you, Tim, for being on the producing side and making this awards possible?
Yes, thank you.
You can get the idea. There's a massive team of people that had made this possible, and as someone who hasn't been involved through the awards through this whole process, I'm very confident that the people that have been nominated did touch my life through that pandemic, helping me get the right information. So it's a fantastic awards ceremony to be involved with. So thank you to everybody. Shall we move on to our next category?
Indeed, I think we've got 3 to go.
Three more.
Hang in there. a little while to go and you'll find out who all the winners are.
And keep those comments coming in. It's great seeing them popping up on the screen, especially where you're coming from. It really is truly a global thing, and it's fantastic how united the front is against something that was so impacting on the world. So the next category is care and support. Now, there was a lot of misinformation about how are we best to look after ourselves, what is the best sort of care for the symptoms, how do you look after other people, and this awards category is all about recognising the influencers that helped us with the information in that area. So, of course, we're going to go to our co-hosts. So we have Olga Shlevenko in Amsterdam. Olga, can you hear us? Fantastic.
Yes,
How
I
are
can
you?
hear you. Hello, everyone. Fine.
Perfect. So you're with the EFU International. Do you think you could give us a little bit more information about your organisation and what it is that you do?
Yes, of course. EFU International is a Dutch public health organization dedicated to giving support and a strong international voice to underserved populations. And we work in Eastern Europe and Central Asia. Actually, since 2001, we have been working for all people in this region who face barriers to access in health, justice, and social participation. And speaking about our focus, health-related areas, these are communicable diseases with a special focus on HIV, tuberculosis, hepatitis, and of course, COVID-19, and also sexual and reproductive health and rights and harm reduction. And the EFU International is a part of the EFU partnership, and we have partners in Kyrgyzstan, Ukraine, Kazakhstan, Uzbekistan, and other countries of the region.
Fantastic. So how has your organisation interacted with social media through COVID-19?
Yeah, actually, during COVID, we really needed to adjust our work by creating some fast response materials and adapting our programs. And one of our goals was to continuously collect and share the latest information and guidelines on COVID in English and in Russian. And as you probably know, in most of the countries, governments have passed emergency laws to tackle COVID-19, and there were even states of emergency. And these measures restricted freedom of movement. People couldn't go to friends, to family work, etc. And actually, internet and social media were sometimes the only way of getting information from the outside world. And it was very important to stay calm, filter information, and choose correct info sources. That's why we really made a very big effort to keep underserved populations in our region updated about COVID. So we created a special corner on our website, which contains specific information for underserved populations. We constantly updated lists of the resources with helpful and, most important, verified resources. We created different series of publications where we were talking about how organizations actually tackle COVID-19, how they solve the problems and how they find new opportunities. We also launched some programs specifically for COVID-19 support. So we did really a lot during COVID, and that's why we were very happy to be co-hosts of the award and represented in Eastern Europe and Central Asia.
It certainly sounds like you kept yourselves busy, that's for sure. I think the timeliness of information is a really interesting part that you factored on, how quickly.
And Olga mentioned the availability of material in English and Russian. I think you're also highlighting some of the challenges with getting material and information in certain languages during the pandemic.
Fantastic. Should we watch the video of the shortlisted nominees for the care and support category? So many incredible countries. It's amazing to see the comments popping up as well. We've got quite a few of the different nominees saying hi, so thank you so much for engaging. Olga, do you think you could give us the winner?
Yes, I also have here an envelope, a golden one.
A gold envelope as well. We could have an envelope off at this point, aren't we? We've had orange ones, blue ones, and now we're on to gold.
So it's a real Oscar moment, huh?
Yeah.
Yes, so, and the winner is Yelena Belakonь from Kazakhstan.
Oh, wow.
Yes.
Wow, congratulations, Yelena. But that's also a really nice coincidence because, Olga, you agreed to facilitate this this category a long time ago.
Yeah.
And here we have a winner from your region.
Yeah, it's really very symbolic for us that, because Kazakhstan, of course, is one of our countries, of our region. So I'm very happy for Yelena Belakonь, and I really hope that she will continue and her organization continue their great job.
Yes. Again, I would really encourage everybody to explore all of the nominees in this category, the shortlisted ones in particular, and follow them. We'll say a bit more about that at the end.
And all of the nominees will be listed on the website and a lot more information, so you can always check that out afterwards as well. Olga, thank you so much for joining us and for being a co-host of this awards.
Thank you.
Brilliant. Moving on to category number 6, which is vaccines. And I think this is a very complicated category. All of these categories are hard. I can't imagine what the judging process must have been. There were so many different vaccine options, so many different perspectives. Should you have one? Shouldn't you have one? The different trials. You've got the supply chain availability across the world, different equality of who's getting what. Very complex area in the health and information out there on social media. So that is the focus of category number 6, vaccines. Now we're going to be going over to our co-hosts. So we have Asad Liam, who is from One by One campaign. And I believe you're from New York, but you're somewhere else right now.
Yes, can you guys hear me okay?
Absolutely, loud and clear.
Perfect. Yeah,
Hi,
I'm from
Asad.
New York. Hi, and I'm currently in Spain, Madrid, for a meeting on Gavi on vaccines, so it's great that you're here. But I was born and raised in Tanzania. A bit complicated, but...
Fantastic. Thank you for taking the time to join us. Do you think you could give us a little bit more information about your organisation and what you do?
Sure. So first of all, thank you so much, Vanessa and Tim. And of course, the organizers for this great event and, for the opportunity to be part of this great event. Before I speak about what we do, I would just like to highlight that, there's been a lot of work done behind the scenes for more than 6 months, day and night. We really appreciate you guys, Tim, and of course, the whole team that made it possible for the influencers to be recognized through this event. So we are the Access Challenge, a nonprofit, trying to work, of course, all across Africa with a history of over 20 years in vaccination and social media campaigns. We launched the One by One COVID-19 campaign, which was launched in 2020 with the African Union, the Africa CDC, WHO, the Jakaya Mrisho Kikwete Foundation, the Rockefeller Foundation, and many other partners. The campaign's goal was to run a strategic communications campaign to fight misinformation and to drive the vaccine demand on social and traditional media using influencers. We have mobilized many influencers, from various sectors, such as community and faith, politics, music, sports, journalism, comedy, TV, radio, arts, of course, among many, many others. In the past 2 years, we have run 5 social media and traditional media campaigns with influencers in Africa. The first one, was a continent Africa-wide campaign called the Africa COVID Champions. And then following that, we have had country-specific campaigns in Zambia, Uganda, Tanzania, and DRC. And we're very proud to say that we've reached over 70 million people, driving and trying to encourage them to get vaccinated across these countries on social media alone.
It's been amazing.
Wow, that's some really big numbers. The difference that we've made is fantastic.
Can I ask Asad a question? Asad, we've talked about this many times, and it's been a pleasure working with you on the campaign, but let's talk about lessons. You know, what have we learned? You've been working so much on social media and using influencers across the continent. Have you got a take-home message or lesson for the people watching?
Yeah, I think I just have one small message, and I think it really, tries to resonate with these awards. Given that we had lockdowns, and like physical meetings were almost zero, I would say social media was not only important, but, was one of the most critical and effective tools to save millions of lives. And it's basically proven and shown through our campaigns that has reached, of course, as I mentioned, over 70 million people. So my message now is we need, to like double down on social media and let these awards, be the inspiration that we need to include social media and really use, the digital platforms, to achieve our critical public health goals.
That's great. Thank you. Hallelujah.
Shall we move on to see the shortlisted nominees in the vaccines category?
Amazing shortlist of people, but if you think that's impressive, you should also see the people who didn't make the shortlist. This was probably the toughest category of all, not least because of the kind of divisiveness of vaccines, and divisions and polarization that it created. So partly for that reason, I think we've got a slight difference with this Oscar moment. Is that right, Asad? Can you break the suspense and let us know the winner?
Yeah, sure. So I know this category was so tight and we had so many great nominations. So also I'm very excited to see who has won this category. So thanks, Tim, for the envelope. I'm going to also open my envelope here. Oh, wow. Okay. So I guess this might be the first category where we don't have just one awardee, but we have two joint winners, showing how tight this category was, but also, like how we had not just one, but two. So before further ado, and not to keep too much suspense, the first
There's
joint
a lot of
award.
suspense right now.
The first joint award, drum roll, goes to Dr. Benjamin Judulbaye from Chad. And the second joint award goes to Dr. Hector Frisby from Mexico. Many, many congratulations to the two winners. This is so very well deserved, especially because of how tight this category was. Thank you for your commitment and your dedication on using your platforms to save millions of lives. Thank you, Tim. Over to you.
That's just great. I think that's a great response to the challenge we had with this particular category, and also brilliant that it's split between the Africa region and Latin America, South America. We won't force them to share a trophy. We will provide a trophy each. So congratulations to our joint winners of the vaccines category. And Asad, thank you very much for today, for your support to the awards, and for our ongoing collaboration. Thank you.
Pleasure. Thank you.
I've just seen a particularly great comment pop up that I just feel like I can't not mention, and that is how nice it is to see the positive side of social media. Right. I think so often in the world we're criticising social media for the negative impact it has on society, and actually these awards are a really great way of actually showcasing that if used correctly, social media can be really powerful and helpful. So I think that was Beatrice. So thank you so much for getting those comments in. Keep the comments coming. We're really enjoying reading them. Moving on to our final category. So this is long COVID, and there's all kinds of different information that's been out there about what is the long-term impact, how will I recover, when will I recover, what might my symptoms be. how does my recovery outlook look? And this is the category to look into the influence that's been helping us cut through that information. Now, again, we will be going to our co-hosts. So we have two co-hosts of this on this one. So we've got Andrea Kuna and Ben Abbott from Communications Medicine. I believe you're both in London, so not too far away from us at all.
That's right.
Fantastic.
Thanks, Vanessa. Thanks, Tim.
Thank you for joining. Do you think you could give us a little bit of background on your organisation and what you do?
Yeah, so we are both part of the Communications Medicine team, and Communications Medicine is a new open access journal from Nature Portfolio. So we belong to Springer Nature, and we're a medical journal that publishes across all of clinical, translational, and public health research. So we've published a lot of COVID content in 2020, 2021. And we, so the journal publishes research studies in advance that helps prevent, understand, and treat human disease that is relevant to a specialist audience.
Yeah, and I guess also we aim to kind of work with researchers quite closely within the communities that we serve to help them find a home for their work to be published. Meanwhile, we want to maintain high standards of peer review and research integrity, and also fostering things like open science, diversity, equity, and inclusion in scientific publishing, and also trying to promote public trust and understanding of science as well.
Mm-hmm.
So I'm guessing through a lot of these sort of the journal, it's slightly more longer form content and research of all of the peer reviews, etc. How have you found the connection with social media through the pandemic been with that?
I think as a journal and a publisher, social media is an incredibly powerful tool to be able to disseminate and promote the work that we publish, and authors really appreciate us tweeting their work and engage with tweets about their work on Twitter, and it starts a conversation about the work as well that happens beyond the peer review process. I think more broadly, social media has really had an unprecedented role during the pandemic in disseminating information in real time, as it emerges, and bringing people together and promoting, collaboration between different groups as well. I think, bringing it back to long COVID in particular, I think social media has really been a form of solace and support for people with COVID, but particularly those with long COVID whose symptoms might have gone on for quite some time. And I think, we owe a huge debt of gratitude to the social media influencers that we're recognizing today for the tireless efforts that they put into spreading the word about long COVID in particular. I think this was really valuable to that community who may have felt isolated by their health concerns and benefited from hearing about other people's stories and experiences of long COVID.
And before other people were doing that, it seemed to take so long for the conversation and for the research and even the thinking on long COVID to actually build momentum. And so some of the people, the influencers focusing on long COVID, were really breaking that ground for everybody. It was nowhere else to,
So that initial patient-led research and effort was really critical, and we very much see as now a continuing role for journals, and in particular Communications Medicine, to continue to raise awareness about the need to do more research to understand the risk factors, to understand how to diagnose and how to treat the people who are living with it. We see it very much as one of our roles, and we want to involve everyone that is relevant in that conversation. So patients, patient advocates, the medical community, scientists, and
I think that's one of the. Sorry to interrupt you. It takes a long time to get a new journal off the ground, and I just think you're doing an amazing job. And I think the niche that you're carving out is you've just described it, so I won't say again.
Thanks.
If people haven't read or looked at Communications Medicine, I think it would be worth your while.
I think it's really powerful, something you just mentioned about the conversation point of the use of social media, the fact that actually when you have an influencer who's got the right knowledge, it isn't just a projection of stuff, it's the ability to ask questions and engage. And so when you're thinking about fact-finding and getting the right information, it's a really valuable part that I don't think we've kind of touched on quite so much as we've gone through the categories.
Right.
that use of conversation, engagement of social media.
I think that's what Assad was getting to, saying it's kind of it's a health technology in itself. We think of health technologies as diagnostics or treatments and things like that, but actually that kind of interaction is a health technology in itself.
Shall we look at the long COVID nominees shortlisted?
Indeed. Just looking at those names, I think that anybody that's been interested or touched by long COVID over the past few years will know many of those names. They don't just deserve an award, they deserve a medal. But,
shall we go for the envelope moment and see who the winner is?
Of course. So the winner for the long COVID category.
And we've got a very big
Yeah, we've got a big
oh,
envelope.
wow.
You get the award for the biggest envelope.
The winner is Padma Priya. Many
Oh,
congratulations.
wow, from India. Congratulations, Padma. That's, as I say, as we were saying just now, some of the people working and sharing information on long COVID were real pioneers. And while there might be some good news about long COVID, in that it might, well, be careful what I say, but it might not be as bad as we'd once feared, let me put it that way. There may be some light shining at the end of the tunnel. I think these people really broke ground. Thank you, Andrea and Ben.
Thank you so much for joining. Wow, that is 7 categories and a huge diversity of countries and information. All of the nominees that have been shortlisting are going to be visible on the website, and you can of course see the winners, and all of the information on how to follow them, how to find them across the different social media networks will be available there. Now, we don't want this conversation to stop now. The whole point of these awards is to recognise the powerful and strong positive use of social media through these pandemics. Now, while we very much hope there's not going to be another pandemic coming, but we want to keep the learning, the use and the positive of how these influences are helping us with the misinformation and the massive information online as we move forwards. And from my understanding, all of the winners are going to be getting a trophy. So
Yes.
this isn't just stopping now.
Yeah.
Anything anyone can do to help share the awards, share the great work that the nominees and the winners have done is going to be hugely appreciated and help just give some more positive energy to sometimes quite a maybe less positive environment on social media.
Right. I'd just like to add a few things. Indeed, as you say, from what when we've done these awards before, actually the announcement of the winners is more like the beginning. I don't want to. We've mentioned how much has gone into this and how much effort and commitment people have given. But actually, this goes on now because we can now help showcase these people. So each of the winners will be sent a personalised crystal trophy and a certificate, and we are hoping to arrange a kind of a national or a local event where that can be presented to them. We would encourage, and we'll be organising some of this ourselves. We'd like to organise some interviews and connection with media organisations locally and globally for some of the winners. So it's not just a question of congratulating them, but actually creating opportunities going forward. And we're already talking to some conference organisers about integrating their work into future events over the next 12 months. So I want to congratulate all the winners, let you know that the information about the winners will be posted to the awards website, which just was shown on screen a minute ago. So keep an eye on that. And we really encourage you to follow the nominees, the shortlisted nominees and the ultimate winners, and to really continue to benefit from the information that they're sharing. If you don't already follow us, the Social Media Awards, on social media, that's also a really shorthand way for us to be able to let you know of things that are coming up and when those winners and shortlisted nominees are going to be showcased and when they're involved in events.
Don't forget to use that hashtag.
Oh yes, yeah. So thank you all very much. I think it's been a tremendous series of awards this year. When you said it's not the end, it's the beginning, or you hope there's not going to be another pandemic, just for now, I hope there's not going to be another awards. But I suspect there will be, and we look forward to working with you in the future on the 4th Global Health Related Social Media Awards.
Fantastic. Tim France, Vanessa Ruck, thank you so much for tuning in. Please do share, spread the awards with the world, and massive congratulations from the whole team here behind the scenes that have made this award ceremony possible.
Thank you.